Hello, everyone. I'm Vicki Parsons, and I'm coming to you today with Ballet Austin's Be Well, Ask the Expert. And today's session, I have a special guest with us. Her name is Leslie Passalacqua, and she is a licensed professional counselor here in the Austin, Central Texas area. And so thank you so much for joining us, Leslie. Glad to have you.
For having me.
May is Mental Health Awareness Month, and it is important to me as we talk about well-being and wellness that we don't leave mental health out of the conversation, especially during a month when we're wanting to bring awareness to that. I read recently on the CDC website that mental illness is among the most common health condition in the United States, said that more than 50% will be diagnosed with a mental illness or disorder at some point in their lifetime, and that 1 in 5 Americans will experience a mental illness in a given year. And I know that mental illness and mental health are sort of different, but those are some pretty staggering statistics. Can you comment on that?
Sure. Yeah, no, I think as far as, like you said, mental health and mental illness are kind of different things, but all of us can be prone to mental health issues just by various things that happen in life. That's different from, I'm in a bad mood today because somebody cut me off in traffic, kind of that impacts our mental health too. But mental illness we're talking more about depression, anxiety, so things like sleep changes, sleep patterns changing, appetite changes, things like that. And so yeah, mental health has been kind of on the rise, and I think the pandemic has probably facilitated that a little further up as well.
Okay. Well, I think when I talk to people, if I use the phrase mental health, which for me is actually, it's like saying physical health. That means I'm in physical health, that I'm in mental health, but people jump to a very negative view, I think, and consider just the term mental health kind of in a negative way. And really, I think you already spoke to the fact that mental health and mental illness are kind of different things. Things affect our mental health. And so why is our mental health and this is a loaded question, I'm sure, but why is our mental health such an important part of our overall health and well-being? Why should we be concerned?
Yeah, that's a good question and a loaded question. Yeah, mental health can have a pretty significant impact on us mentally, but also physically. So it can kind of cause stomach issues and some of the physical health problems that are more, I guess, socially acceptable kind of to talk about, as far as like, I went to the doctor for a rash or whatever, is a little bit, nobody's talking about, I went to my therapist because I'm severely depressed. And so, yeah, that stigma kind of exists there, and our mental health is important primarily to keep our physical health also in check, as it can kind of cause physical symptoms. And also sometimes we can catch physical illnesses. Somebody coming to a therapist for anxiety, sometimes physical illnesses, the anxiety can kind of mask that. And so if you have thyroid issues, for instance, then anxiety goes along with that. And so there's so much crossover between mental health and physical health and how they impact each other. And so it's part of, it's hard to separate out, I guess, because mental health affects physical health can impact mental health. And so our mental health, is important also, because if we're not mentally healthy, usually we're not sleeping well or eating well. And then we kind of lose interest in things that are not really exciting anymore, which can kind of progress into mental illness. It doesn't always start out that way. Sometimes we're just sad and maybe we don't like our job, and so that's impacting us emotionally, and so that can kind of contribute then to physical symptoms, as well as just make life not really nice for us anymore.
So what I'm hearing you say is, if I broke my toe, I would go to the doctor and I would have him examine it and give me the best course of action for healing. Or if I'm having trouble sleeping, or having some stomach issues from what I've been eating. I mean, there's all kinds of physical things that we go to a doctor about, or we Google it online and try to figure out how to fix it ourselves. But when I'm feeling exceptionally sad, and I think you're right, we saw a lot more of this during the pandemic across the world. When I'm experiencing something that affects my mood, or maybe even more serious than that, if somebody is experiencing that sort of behavioral or mental health issues, it isn't something we talk about. And it isn't something that we as quickly go and get some advice about, unless there are some symptoms that accompany that, which is sleeping disorders or difficulty with our eating disorders, or some of those kinds of things that might creep in. Then we go to a professional. So what is it about the stigma that keeps people from understanding that there is something they can do or somebody else can do?
Well, and I mean, I guess in my experience, I kind of hear clients come to me after they've been struggling for X amount of months or sometimes years. And so, you know, you wouldn't struggle probably with a broken toe for that long, right? And so it is different as far as like, once they come to me or come to a therapist, you know, for a lot of people, that is kind of like, okay, I've tried everything I know what to try, and now I'm doing this. And sometimes that's reluctantly. But you know, that stigma that I hear kind of, you know, from people who come in that haven't come in when, you know, a year ago when their anxiety kind of started, you know, is that my, you know, other people will find out, they'll think I'm weak. They'll think that I can't handle things on my own. They'll think I'm crazy. That's a common kind of misconception, is that if you see a therapist, that means, you know, and it's sad because that prevents people from accessing care when they need it, and they're not crazy. So that also is untrue, but a lot of times people have that perception because of how mental health is portrayed, or mental health and mental health illnesses are portrayed kind of in society.
Yeah, I think there's certainly some embarrassment that goes along with anybody, unless I guess you live in Hollywood, and then it's like the cool thing.
Sure, yeah, it's cool there.
So I know there are some very serious mental health problems and mental illnesses that people might be suffering from. And I know that many people have lifelong events in their past that affect their current physical and mental health. And so there are some very, very serious things. And I would say those are the people that absolutely, for sure, should be seeing some sort of a professional counselor, seeking help if they have not already. But what would you say is the most common mental health issue from those of us that don't have the more serious mental illness going on?
Okay. Yeah, I see. I guess it's changed. It's shifted a little from my kind of what I see in my practice, but right now we're seeing like a lot of either job loss issues or job burnout problems. Essentially, that was really big, I think, in 2020, 2021 with the essential workers. A lot of them were kind of experiencing job burnout, which is a thing that could happen to any of us. And so, you know, they don't have a major psychological mental health issue, but they have a lot of feelings and thoughts that are causing significant problems in their life, such as difficulty concentrating and not wanting to go to work or being too involved in work. You know, those are both kind of symptoms of job burnout. So that's been a more recent kind of, there's been an uptick in that. I would say, I guess, for kind of outside of pandemic stuff, probably anxiety, depression is probably the most common things that I see, at least, that, you know, people aren't severely anxious or severely, they don't have severe depression, severe anxiety disorders, but something happened in their life, or for whatever reason, they're feeling more anxious. And so coming to counseling kind of gives them a place where we can kind of find what's causing that kind of those symptoms that they had started experiencing. And then we can kind of figure out how to deal with those or handle those, handle the situation, whatever it might be, in a different way, if whatever they're trying isn't working for them.
So we can't always just snap out of it. Just snap out of it. Go for a walk, and sometimes that helps, and sometimes it doesn't. So you're a licensed professional counselor. What is the role of a mental health counselor? What do you say your role is?
I feel like my role is kind of meeting my client wherever they're at on their mental health journey there, whether it's just started or it's been lifelong. Kind of meeting that person where they're at, and then kind of working together on, what is our big picture goal? Where do you want to be in life? Where you're at now, where you want to be, and then we kind of together sort of figure out some steps and how we're going to get to that long-term goal.
And if I am kind of summing this up as far as your role as a counselor accurately, correct me if I'm wrong, but it is a therapist, a mental health counselor is somebody you don't want to have. Certainly some people might need this, but your goal is to move beyond that counseling, correct?
Yes.
Not, I think I have heard that it can easily become kind of a long-term relationship that's hard to break. So your goal is to move people forward to wellness so they don't have to come at least on a regular basis. Am I summing that up correctly?
Yeah, absolutely. And sometimes people struggle with that because it is kind of a different relationship, I guess, than you have with anybody else, really, I would imagine. But, and so sometimes clients are hesitant to be like, oh, what if I leave and it happens again? Or what if I don't remember what we put into place, or what, all of these kind of concerns come up sometimes for the client. So part of my role too is determining, okay, you're ready, but you're nervous, right? And so that's okay, but we can, you can do the things. And then I typically schedule, like, if I've been seeing them every couple of weeks or whatever, I'll schedule them for like 3 months out or whatever, and just do a check-in to kind of make sure that they're maintaining the coping skills that we've put into place.
Well, thank you. I'm going to wrap this up with a final question here in a second, but during Mental Health Awareness Month, I think what I'd like for people to hear is that push aside the stigma, that if you're struggling with something that a friend or family member, and certainly not by yourself, you're able to work through, that there are licensed professional counselors out there who can talk with you and at least get you started on a path. It's my hope that nobody would struggle with a physical illness for life, although I know people do. It's also my hope that mental health isn't a continuing problem in people's lives. So seek professional help. So Leslie, before we go, if there's one thing that you would most want anyone to know about mental health, one takeaway, what would that be?
I guess in terms of, I could share one of my favorite coping strategies that people can try. I guess is people with mental health, significant serious mental health issues, or people who really don't have any kind of mental health issues and are feeling fine. But that coping strategy that I kind of talk to about people is using your 5 senses. So if you're in a work meeting, for instance, and a lot of anxiety kind of comes up around whatever, kind of pausing and mentally noting something you see, something you smell, something you hear. So you might hear the ticking of the clock, you might feel the cold chair, just to kind of reorient yourself to kind of present moment. That can be a really good strategy to use in daily life with significant mental illness. Without significant mental illness, I use it a lot. So just to kind of get back on whatever you're doing in that moment and not kind of stuck in your head, if that makes sense.
Yeah, that's a great practical tip, and I also do some of that, and I know that it works. So thank you for sharing that. And Leslie, thank you for joining me today. And I want to encourage everyone out there who's listening that might be wondering. If you're wondering, it doesn't hurt to seek professional help if you're wondering if it's time. And so I encourage you to take care of your mental health as much as you do your physical health. And if you're not taking care of your physical health, then you need to just remember the importance of overall well-being in your life. So thank you so much for joining us today, Leslie, and I hope you have a great week ahead.
Thanks for having me.
Thank you.